Hey you all, welcome or welcome back to my channel. My name is Tara. If you are new, I work in clinical research as a clinical research associate. So today I want to talk to you about my journey from starting off as a medical assistant making $12 to now as a CRA making over $80,000 a year. So I started off as a medical assistant 2009. I went ahead and I went to a technical college here in Columbia, South Carolina, and I got my medical assistant diploma. Y'all, I went and took the certification so that way you could be certified as an MA. Failed the first time. So I still was luckily able to have a job within medical, I'll say. I was a first aid representative at a turkey plant in Newberry, South Carolina. So at that time is when I kind of got introduced to filing, and I got introduced to writing chief complaints and wrapping people's wrists and checking blood pressure and blood sugar. So I went ahead and I took my examination again, and thank God I passed my test. So at that moment I was still working as a medical assistant, and I was like, what else can I do besides work in a turkey plant, because I know there's more that I can do with my certification. So I got into ophthalmology. So that was my first therapeutic area, was ophthalmology. I started off there as a ophthalmic tech. So my medical assistant and ophthalmic tech degree, it kind of, well, my medical assistant degree and my ophthalmic tech job kind of ran hand in hand, because I was able to do chief complaint. I was able to check blood pressure. We didn't need to do like any blood sugar, but I still was able to work in the medical field. From there, I got introduced to clinical research. So I said, how can I make everything work for me? My medical assistant degree, my knowledge of ophthalmology, and my willpower to want to get into clinical research. Because at first I was like, clinical research, I don't want to be in a lab. But when I started to get more knowledge about it, I'm like, this is something interesting. This is something that I would want to be a part of. So I went through a temp service. I think it was like Kelly Services, or it was a temp agency that introduced me to the first entry-level job that I had. And when I say entry-level in clinical research, I mean entry-level, y'all. I was making like $11, and that was less now than what I was making as a medical assistant ophthalmic tech. I was making like $11 when I went to be a refractionist. So I started off there, and I was there under a mask role, meaning you don't ask the subject how they're doing. You're not even going to know what type of medication the subject is receiving, if they're receiving anything at all, because they could be receiving placebo. So I did that for a couple years. I was like, I'm tired of this. I'm gonna go back to ophthalmology. Utilize my medical assistant degree some more. Did that. Came back to clinical research in 2020. So I started off in clinical research 2013, took a break, fully got back in 2020 as a CRA. Now, let's not get this CRA mixed up with what I am now. So I was a clinical research assistant in 2020, but it just wasn't working for me at that time, because I was like, oh my gosh, I'm about to get my degree. I want to do more. I want to be a CRC. I want to be able to, really look at source, be able to look at what medications they're on, be able to speak to the monitors, be able to just learn so much about clinical research. And being a CRA assistant, I didn't realize the blessing that I had in my hand. I did not realize the blessing I had in my hand, y'all. So left that role, and I became a CRC. Became a CRC for a while, and then I went strictly remote as a CTA, as a clinical trial associate. And I was working from home. I was filing things in the TMF, doing meeting minutes, agendas, newsletters, and things of that nature. And then finally, I got an opportunity to be in a CRA Academy program in October of 2021, and that's when I became a CRA, clinical research associate. You guys, my entire salary just doubled just like that, with me being a clinical research associate. With me, and I feel like the reason that I was able to transition so well, and I was able to grasp the CRA world, is because I came from that medical background. No, I wasn't a doctor. No, I wasn't an RN. No, I wasn't, this person with this high education degree as a PA, a doctor, you know, things of that nature, but I had that experience of being a medical assistant. I had that experience of having empathy because I know how it is to be site level and have so many patients, and then you're trying to do something else for someone that may require documentation. So now as a CRA, I'm able to have empathy with my sites and say, hey, just because that site has not gotten back to me right now does not mean that they are ignoring me. So yeah, you definitely can do it. You definitely can do it. When somebody say, hey, you may have to start off entry level, it's nothing wrong with that. It's nothing wrong with that. Just know that just because you are a CRA, just because you are a clinical research assistant now, just because you're a medical assistant now, just because you're a CNA now, it does not mean that you cannot convert over to clinical research. I hope you all have a great day, great night. My name is Tara. Make sure you like, comment, and subscribe, and I'll see you in my next video.